Welcome to Senior Care Matters, the show that guides you through today's challenges of aging with clarity, compassion, and confidence. From essential resources to real-life solutions, we bring you everything you need to know to navigate life as a senior in today's world. My name is Dana Arnone. Believe it or not, I once dreamed of a career in fashion journalism, but life had other plans. I became a registered nurse and eventually the owner of a home health care agency in Long Island, New York. Now, I'll be honest, some days are hectic and sometimes I just want to scream, but my mission and my passion is what keeps me going, helping seniors navigate the chaos of aging in today's world. Every day I see the challenges our seniors face, and it drives me to fight for change, because no one deserves to face the end of life alone. After all, sooner or later, we will all be seniors. So come join me on this journey where we tackle the tough questions, uncover the truth, and fight for the dignity, fairness, and justice for our aging community. Welcome to Senior Care Matters. Welcome back to Senior Care Matters. I'm your host, Dana Arnone. Today, we have the pleasure of having a conversation with Dr. Sheryl Pearl. Dr. Sheryl Pearl is a board-certified physician in family medicine with extra qualifications in hospice and palliative care. She completed a fellowship in long-term care for the elderly and an MBA from NYU Stern School of Business. She is also the New York Medical Director for Noble Care and the owner of Geriatric Risk Advisory, a company that helps families understand what quality of care means and what expectations one can expect from a hospital, rehab, nursing home, home care agency, and assisted living facilities. Wow, that's a lot. Welcome, Dr. Pearl. I'm so glad to have this conversation because one of the things I see in my daily practice is that people really don't understand, what can be done in the home, and that they can actually have physicians come to the home to provide that care. So I think this conversation is very important for families to get an understanding. So a little bit about you. I know you work with a Noble Care. Prior to that, you owned the practice.
I did house calls for close to 30 years, and I've done them in different environments. I think anything that you can do in the office can pretty well be done at home. And for someone who's a little frailer, someone who's tough to get out, someone who's come out of the hospital, someone on oxygen, recent fracture, someone who uses a walker or is bedbound, these are people who really need to have a house call and have a provider who is experienced, who knows how to get the durable medical equipment and the things that, the physical therapy and all the other resources that you need to maintain that person at home safely.
Yeah, I think one of the things that people, when we're talking to families and we know that the patient's homebound and they cannot access, or a lot of times they don't even think about the dollars of getting someone to a hospital if they have to, order an ambulance or something. So we go over, I find that they're always very surprised at all the things that we can do in the home with the cooperation or the assistance of a doctor that makes a home visit. So tell me, the person that usually will access your help what do they look like? What kind of patient is that?
It's everybody, and it's any one of the ones that I just talked about. It's anyone with a neurologic type condition, MS, ALS, on ventilators, wound care, difficulty getting out, difficult getting transportation to their physician's office. If you don't have Medicaid and you need transport, it is quite expensive if you don't have someone who can assist you with that transport. And having your 90-year-old spouse help you, who's as fragile as you're both going to go down together and break hips.
So as far as a doctor coming to the house, do you work with it? Can they maintain their doctor in the community? Someone that they've been seeing for 50 years, what happens to their regular doctor, their PCP that they had?
It depends which house call company you call in. Some of them want to be the primary one, and some will allow you to maintain another physician.
What does that mean?
That means some of the house call companies have become accountable care organizations and they want to be listed as the primary physician, and some are not.
How would the family calling for care know that? Like, how would they would call you up and they would say, will you take over? Because I know giving up that doctor is very hard for families. It's probably one of the most stressful things that they do.
Right.
And they don't want to do it.
But the truth is, many of them can't get out to that primary care doctor anymore, and it's unfair to ask him or her to sign orders on an individual that they can't see. It's not safe.
Yeah, I think it's funny because you're going back to that, the doctor with the little black bag, right, making
have
house
one.
calls.
Yeah,
Oh, do you
it's a
really?
big
I
black
see
bag,
that. But I think that we always go back to what used to be, and I think in this situation, a lot of times families don't realize that you can have a doctor come, order blood work. If you fall, get an X-ray. Anything that we do dental now, like we set up visiting eye services. So I think that people have to really start to understand that the home care, if you want to age in place and if you want to age in your home, there's many things that we can do to help access the help in the house. You being one of them,
Right.
We've worked with you for many, many years.
I think the other thing you have to say is that no one gets older and says, oh, Dana, I want to go to a nursing home. Everyone says, I want to stay in my own home.
But we say now it's not about the need, it's about it's about the need. So sometimes they want something, but it's not in their best interest.
100%.
Yeah. So, but with the doctor, I think that what comes up a lot for us is that they'll call and they'll expect a doctor the next day. And that's not the way home doctor visits work. So there's a process of intake. Right? There's
100%.
What would you say if someone called you on a Monday, you'd see them within 2 weeks, within a week? Like just so people have an expectation.
Within 2 weeks, but it depends on the insurance too.
That was my next question. So Medicare?
Medicare, everyone would take at home, but every provider takes different insurances, and it depends on the arrangements that the organization has with that health insurer.
Right. So if someone has Medicare with no secondary, is there an out-of-pocket expense to them?
Yes, because Medicare mandates that we balance bill the 20% that's not covered. Now, if you can't afford it, then you should be on Medicaid as your secondary. And I always advise everyone to speak to a senior care attorney to see what can be done right at the start so they can save their money and make it go as far as possible.
Right. And I know one of the specialties that you have is dementia care. So you had a dementia screening process that you do with families. And what is it that you think that they're getting out of that screen?
Well, I think it gives more insight to families as well of what level people really are at, because a lot of people and families will say, well, my parent's a little forgetful, but she doesn't have dementia. But then when you screen them, they do not know the year, the month, the day. They don't know what's going on in the world. They're much worse. I think people have to accept certain diagnoses and then plan for them.
So if someone calls you for a visit and you're going to do that screening process, are you also ordering medication for them? Are you referring them to other specialists?
Not everyone needs a full screening on day one. We will make recommendations. We'll order blood if it's appropriate. We'll do whatever they need to stay in the home safely.
So if someone is at the level of, let's say, a two-person assist, or doesn't have that family supportive system, and they really are not safe to be at home, what is it you suggest for them?
Then they need to consider alternative placement, which would be an assisted living where they would have two people, and they can do Hoyer lifts in many assisted livings, or a nursing home in the long term. And people who get placed in assisted livings who fall repeatedly and don't have the supervision they need, and it's what facilities will promise them, and placing them into the right level of care.
So what you will do is when someone is becoming not appropriate for home or not safe at home, you're guiding them towards what assisted livings they should go to that'll give them that level of care, or a nursing home?
Yes.
So what is it that you're saying to people? Like, how are you guiding them in that situation?
Well, if someone's falling repeatedly, then they should be at home with 24-hour care. The problem is the nursing home waiver that I know you're very familiar with and I love is cutting off to new people, which is going to really cut care, because then you have people at home who only get approved for 5 hours of care or something, which is completely inadequate for someone who has a significant cognitive impairment. And someone like that would then end up in a nursing home. And I think the government cutting off the number of people into New York State's, waiver program is a tragedy.
That's a big problem. How does a doctor that makes home visits, provide that care or provide that help or the direction to the families?
We talk to the families. And that means there's an involved family. It's better if they're local than, on the West Coast and we're on the patients on the East Coast.
Yeah, but you know why people don't do what you're saying, though? Because they're not giving up the house.
But the problem is that's not the children's money.
Oh, I know.
it's their money. And that is a huge problem I have with families. So many times the children consider their parents' money their money, and that is why they don't get a second person to help them out or the care they really need.
So another thing I think that is something that you do very well is really advocating for families if they feel they were wronged in a certain kind of way, right? If they feel like they weren't getting the level of care or assistance that...
Yes, but families don't even know entirely what they're entitled to, I believe. You know, you go into a nursing home and you're not turned or positioned, you don't get the right boot, your skin breaks down. And I've had families think this is the standard of care. That is not the standard of care. That should not happen. And you have to have enough knowledge of the system to go to the nurse or the physician and say, I want this, I want that. This is what should happen.
What type of patient do you think cannot be handled at home?
Someone who has strong behavioral component where the aides are quitting. Someone who has no one nearby to provide those other 10 hours of care in a cognitive impairment.
Yeah.
And can't afford an extra aid.
Well, my question is that what is the outcome that you want to have families understand about if they want to talk to you and they want to say, hey, Dr. Pearl, I want to know, was my family wronged? Or, hey, Dr. Pearl, is this the right care that my family's been receiving? What is it that you're going to tell them?
It's even after the fact. If they get a urine infection and they go to the hospital, most urine infections are not preventable, and I've had families brewing for years over this, and they need to get over it. Or in nursing homes, they need to, they're still brewing about the care. And I say, well, what did your mother die from? And they died from something that wasn't related to a wound, that wasn't related to a fall. How do you feel the care was bad?
So I know one of the things that you're a very big proponent of is that you're a very big advocate for care. So just as we're, summarizing our conversation here, what is it that you want people to understand about advocacy and the care that they're being provided?
People need to understand realistically what can and cannot be provided, and people will often be promised, the world, so they'll sign a lease and come in. They need to have realistic expectations. They need to know what can really be done in each of these places. And many times, if you have someone who falls, it is not ideal for them to be in an assisted living, or for that matter, maybe even a nursing home. People need to understand what can and cannot be accomplished in each level of care, being home, being assisted living, being nursing home levels of care.
I think that's fair. So if someone wants to reach out to a Noble Care or get you on the phone or talk to you about their needs that they're having, how would someone get in touch with you?
Well, for Noble Care, they can call the office, which is 516-569-0776.
Yeah, I think that if anybody has any questions, I can speak personally that I know that you're extremely helpful and you do a very good job at guiding people to what's appropriate for a level of care for them. So I think people should definitely reach out to you. But as always, always a pleasure.
It's a pleasure to be here.
It's time for a short break. We'll be right back with Senior Care Matters after this.
Body by Peter offers a premier at-home concierge service specializing in empathetic lymphatic massage and blood circulation enhancement. We provide a range of therapies, including red light therapy, wood therapy, body sculpting, and lymphatic detoxification. Our professional and compassionate approach ensures a rejuvenating experience in the comfort of clients' homes. Servicing Manhattan, Queens, and Long Island, New York. Call today, 516-509-3825. Every day, home health aides travel miles across our city to care for seniors who depend on them. But too often, long commutes and poor transportation keep them from reaching those who need the most. At All Things Home Care, we're changing that. By providing subsidized rides, we take the burden off caregivers so they can focus on care, not the commute. Because when caregivers are treated with dignity and respect, our seniors stay safe, cared for, and never alone. Join us in supporting the people who care for our loved ones. Learn more at allthingshomecare.org. We all say, today is the day that we tackle the organization of our homes. The day gets further and further away, but the job never gets smaller. We can take the headache out of planning and doing. We start with a free consultation, create an action plan, and bring you the space and peace of mind you need. We help with home decluttering and organization. Restore your home to a place of comfort. Call today, 516-322-2613. At Reliance Home Senior Services, we believe every day shines brighter at home. As a licensed New York State-based agency owned and operated by a registered nurse, Reliance brings over 20 years of experience and personalized care right to your door. Our certified personal care and home health aides assist with bathing, grooming, dressing, medication reminders, light exercise routines, and to accompany you to appointments, all while offering companionship and a safe, caring presence. Need help navigating Medicaid? We're here for you. Our team of registered nurses and social workers offers in-home geriatric management, so both you and your family can breathe easier. And with 24/7 on-call support, bonded and insured aides, and a custom plan of care crafted just for you, we bring peace of mind right into your living room. Reliance Home Senior Services, bringing comfort, independence, and trust home.
Hi, welcome back to Senior Care Matters. I'm your host, Dana Arnone. Today's guest is Linda Polistin, owner of Space at Home. Linda Polistin is a social worker with over 25 years experience supporting seniors and their families through transitions in care. Her passion is helping individuals maintain dignity, independence, and quality of life, whether it's at home or in a long-term care setting. Linda enjoys guiding families through challenging decisions and advocating for their best possible outcomes. And I know this personally. Linda, how are you?
I'm good.
I
How
already
are
know
you?
who you are. I'm very well. So I think people, know our relationship, but they also know you as Director of Social Work at a long-term skill facility and rehab center. But I think what people don't know about you is your private side and your business that you have. So why don't we talk about Space at Home, exactly what that is, so that people understand what it is that you guys do.
I've always have a passion for seniors, and when I saw how clutter can really affecting their safety at home, I wanted to create something that can give them back their dignity and comfort in their home. And I decided one day, when I discharge people home sometimes, I used to do some home visit, and you find it was very unsafe to let someone go home. So then I decided it's something that the community need. And someone has to come and do something about it.
Being in home care for so many years, I could tell you that it's a big problem that I think people are embarrassed saying that they live this way. And so having someone like you coming from a social work perspective, having conversations about how did it get to the point of where it is and how we can help get them out of that. So what inspired you, would you say, in helping seniors?
You'll be very surprised to see how seniors are living in their home and very unsafe. So sometimes they don't have family. Some of them has family. They're not involved. But then I think it was a necessity to create something that can really make them leave home safely and be happy at home.
So your focus is a lot on safety.
Yes.
And keeping them safe at home. So what barriers are creating safety issues when their house is cluttered? What do you find mostly is the issue of safety?
Definitely, if it's unsafe, it can cause a lot of falls at home, and also they can end up in a hospital, and which I think that it's important for someone to just make sure that the house is not cluttered.
But when you say cluttered, are you talking papers? You're talking messy? You're talking
Everything.
dusty, not clean, everything? So what do you mean by everything?
When I mean by everything, people don't let go things. It could be paper, newspapers, clothing, everything. They just don't let go things.
So do you feel being a social worker and having a social work perspective helps them understand that they can let that stuff go?
Absolutely.
Do you find they let the stuff go?
Well, there's a way, okay? And I think that from experience, it's always the approach, how you approach the situation. Then I think once I start talking to someone and let them know, you don't want to make them feel guilty. You don't want to make them feel that, you don't want to make them feel shame of the situation. But it's always make it very positive. The goal is to help. The goal is to bring them back to the joy that they used to have prior.
Yeah. I think one of the stories that you were telling me the other day is that somebody recently that you were cleaning out, that the daughter wouldn't even go and visit her mother anymore.
For years.
For years. And now that the house is, clean. I mean, cleaner than it was. You know, the daughter will come. The daughter will come and have tea with her mother or coffee. And I think that's so nice. I know from nursing and from home care, nobody ever says to us, my house is a mess, can you help me? It's usually that we're entering into the home to do our assessment, or the aides are calling saying, you got to come see this house. So what is it you do when someone calls you and says, my patient needs help, or this aide is telling us that there's an issue here? What is your first approach with people?
Well, the first approach, if they have family involvement, we start with the family, because you mentioned something that's very true. They're not going to tell you the house condition. But if I happen to know, sometimes it's a neighbor. Sometimes people take pictures and show you. Mm-hmm. So the approach can be where you talk to the family, let them know how unsafe it is and how can we make a change. But the good thing is also, I kind of respect their way, and I work with them in a way where, for instance, you don't have to throw things away if you feel like it's important to you. So I can put things in boxes, save them for you, so at least they know it's still there. Mm-hmm. But in the meantime, we can work in the house, make the house, unclutter the house, I should say.
So most of the time when you're cleaning them out, is the person present and guiding you what they want to keep, what they want to throw out, what they want to save?
It's always the best way to do it that way. So whether it's a family member, or I will let them know like this. I did a house, an apartment in Deer Park. Mm-hmm. So the patient was in the nursing home. So I asked the social worker to bring the patient to the home. And I said, tell me what's important for you that you have here, and let's find them first. And she told me, and we were able to find everything that she cares for. And the rest, she's like, everything else we can throw away.
Yeah.
And it gave them, it's the trust now. They feel comfortable.
Too.
Yes.
Yeah, so that's important for people to know if they have someone in a facility, a hospital, or a rehab center getting ready for discharge, that if they need them, they can go out on pass for the day. They can go and meet with you in their home and guide you through they don't have to be there when you're cleaning it, but if there's things that they want to save or put to the side, they can go home on a pass.
Absolutely.
But it's best if they're,
it's
most
best
people.
If they're there, because they also feel like, you know what, they don't have to worry about, I'm going to miss something. Mm-hmm. They be a part of the job. So a part of the plan, I should say. So it's much better like this. Or if there's a family can be there as well, let us know what to do. But if it's going to take some time, I always recommend that let's put them in boxes. So then later on, when you come home, we open one box at a time and see what you want and what you don't want. And I think a lot of people love this idea. Mm-hmm. And they start we box it for them, we put them in the garage, or if they have an extra room, we can put it there for them as well.
Yeah. I think, people don't realize how decluttering the house and cleaning it changes the whole overall being of the patient and how they feel about themselves and how happy, it makes them. I mean, we had a patient that we took care of years ago, and, that both the husband and the wife were in the facility at the same time, and the husband utilized that time that they were in the rehab to say, please go clean my house, because now that my wife is not there, you guys can clean it. And we did that. We went in. But that was a little bit of an extreme case.
I encountered one family that they live in a home for 2 years. They're using a heater.
A heater?
A heater.
Mm-hmm. For what?
Just to heat up the house.
There was no heat.
The boiler wasn't working. Uh-huh. And also they wasn't using a stove. They ordered food out. There's a lot of people that's living home like you would never believe, that in a condition that's so not acceptable.
Mm-hmm. I agree. What have you seen as one of the worst conditions or apartments or houses that you've cleaned out? And has the outcome been positive? Which I'm sure it has.
I've seen places where you couldn't even see the floor. Mm-hmm. So when we're done decluttering, the space looks so much welcoming. It's like giving someone a fresh start.
You go, you look at the space, you evaluate what needs are. If they need cleaning products, you guys purchase the cleaning products. If they need boxes, it's not like the family has to bring all the stuff.
No, exactly.
You'll rent a pod for them, you'll rent a container, you'll do everything that it's needed.
Everything. Mm-hmm. And if a family need guidance, so if they don't want us to do, for instance, for a pod, so we can offer them, so if you want, we can call for you, start the conversation. So the family sometimes wants to use their credit card. I can do the whole thing for them as long as they allow me to. And some of them will say, give me the number, I'll get it done for you.
Yeah. So Linda, right now you're in New York, but let's say someone in California, Florida, or Texas is seeing this and they say, you know what, I could use that kind of help. What kind of suggestion, or what would you do? Like a virtual type of?
We definitely can do virtual, and if needed to travel, then we'll do it. Definitely will go.
So I think people are thinking that it's expensive, to do this, because you're talking about not only manpower of cleaning, and you're not cleaning like Merry Maids, right? You're cleaning filth for
Decluttering,
years,
yes.
but it's also dirt.
Yes.
And it's not pleasant.
Not at all.
I know. And then sometimes you have to bring in exterminators, and there's a whole big thing. So as far as charging people, how do you come up with a fee?
Well, it varies. It's based on the situation. Some people it's a whole house. Some people live in an apartment. Some people live in a studio. So it's just depend on how much do they have. Some people it's extreme. So the price really vary. But the reality is, I work with everybody else. I'll make it work for everybody.
No, I know you do.
Yes.
I think that's very fair. And I want to kind of say you're on a sliding scale. So there are a lot of seniors that live alone, that don't have family, that really live in nobody should live the rest of their lives or the end of their life in a unsafe, unhealthy, cluttered, filthy environment.
Absolutely.
So I will tell you that we work together a lot, and that we do, through our nonprofit, has some source of funding to help. So if there's people that need this and they can't afford it, but yet they do want the help, there's also a way to help get funding for them.
Absolutely. And again, for people that doesn't have, we also, being a social worker, you being a nurse, you know that. So I won't say it's all free, but sometimes it's not so much me making the money. If I get to help someone, as long I can work with them, I could come up with a budget that the family can work with.
Yeah, I think that's very fair. So how do people get in touch with you?
Well, they can call me 516-322-2613. That's the phone number for the business. It's Space at Home.
Space at Home.
Yes.
Listen, I see it all the time. I see the outcomes of the cleaning that you've guys done. I see how happy families are when they can actually go and sit with their loved one. So I can, as a testimony,
Oh, thank you. Thank you.
You're welcome.
Thank you.
Thanks for watching Senior Care Matters. I'm Dana Arnone, and we'll see you next time.